Good morning, everyone, and welcome to our SAGES session entitled Managing Adults with Congenital Surgical Anomalies. My name is Danielle Walsh. I'm a pediatric surgeon at East Carolina University, and my co-moderator for this session is Dr. Gretchen Purcell-Jackson, who is also an associate professor of pediatric surgery at Vanderbilt University. Today, we're going to talk a little bit about a problem that is a newer problem. So, unfortunately, there's two reasons for us to have this talk. One is that not all the congenital anomalies present in childhood. As a resident, I remember operating on an 80-year-old woman who was presenting with malrotation for the first time with a midgut volvulus. And also, increasingly, we've done so well with fixing some of these complex congenital disorders that they're surviving to adulthood. And many pediatric surgical practices are not set up to continue following adults. And similarly, many adult practices are not set up to follow kids that have congenital anomalies. So this session is intended to try and help both populations work on that transition of care. So the objectives of this session are to identify some of the complications related to prior care of congenital anomalies, to manage the adult presentation and complications that are a long-term consequence of these anomalies, and to help discuss transitioning pediatric to adult care in these complicated patients. We have a number of talented speakers with us today, talking on a variety of topics, and our first speaker today will be Dr. Lee Erin Chen, who is local to us here. She is Vice President of Surgery for Baylor Scott & White Health. She works in improving cost effectiveness and operational efficiency and increasing patient and surgeon satisfaction with care. She authored the SAGES survey that was sent out to SAGES members a few months ago, and she's going to present the results of that survey. So, Dr. Chen.